before I introduce Dr. Willerson, I'm going to tell you a little bit about him. He is actually he's the epitome of collaboration. And when I came here about 15 years ago, I met Dr. Willerson. And it was amazing to me how he was trying to establish these collaborations with Rice. And that's how I actually first came to Rice. I met Rick Smalley through Dr. Willerson. And so he was one of the founders of the GCC. He was also one of the editors, a legendary editor for Circulation, which is the top cardiovascular journal. And there's a whole lot more of accolades on top of everything else, but he is a physician and a scientist. He's a clinically practicing cardiologist, and he's been a great mentor to me and countless other students, not only in the higher education, but also high school students. And it's just amazing to have him here. It is a real treat for us to have him, and I'm proud to introduce Dr. Willerson.
Thank you, Paul. I'm going to try to be brief. You've heard a lot about the collaboration that exists, and I have been involved in some of that dating back to 1989, 1990 with Dr. Frank Ryan. Any of you remember him? He's a former All-Southwest Conference Rice quarterback, All-Pro quarterback, nuclear physicist, and I think the provost of Rice in the early 1990s. I'd come back to Houston. I was at UT and the Texas Heart Institute, and he helped us establish meaningful collaborative programs. Those continued with Rick Smalley, and both at UT and at the Heart Institute. We came to know Dr. Smalley very well and worked very closely with him. They continue now with stem cells, regenerative medicine with Jane and Kirsten and others. Now, Paul, with Jim Tour in his laboratory. But the real point here is the Texas Medical Center is so incredibly fortunate to have Rice right across the street and part of the medical center. It's true that some of the very best medical care and education, clinical research goes on in the Texas Medical Center, which is the largest in the world, 8 million patients visiting annually and growing. But the translation of some of that and the development of new devices like heart pumps, like special catheters, like new imaging techniques that are increasingly sensitive, like gene editing and manipulation of genes, will rest in the collaboration between us across the street and you. And what a partnership it could be. For young people, the future of medicine, cardiovascular medicine specifically, is in orientation to disease prevention, minimally invasive, rapid turnovers, but real prevention is going to come from gene editing and manipulation of genes, plus controlling some of the exogenous factors, things we do to one another. And that should ring a bell in all of the young people who are here, and some of the older ones too, about ways we could work together. We have an antagonist and an agonist to the vulnerable plaque in coronary arteries that mediates heart attacks. We have an inhibitor to it and a promoter of it. We're trying to identify vascular inflammation in blood vessels, non-invasively. And we're working with Rice and others to do this, nanoparticles probably. But we're on the verge of something that would be a big breakthrough. One could step into a magnet or a CT device and have vascular inflammation visualized non-invasively wherever it is, and it's bad anywhere that it exists, especially in blood vessels, causes heart attacks and strokes. Regenerative medicine. We can take a biopsy from the hand and convert this fibroblasts into your contracting heart muscle cells in 2 weeks in culture. Or any of us who have a little extra adipose tissue, liposuction provides fat cells that we can convert into your contracting heart muscle cells in a few weeks in culture. We've identified a stop growth pathway in the heart. Within 2 weeks of life, neither you nor I can regenerate our hearts when it's injured to any significant degree. It's because of a maker-placed kinase cascade, which has the unlikely name of the hippo pathway. But when it's knocked out in a mouse, the mouse will completely regenerate the area of infarction, whether you knock it out before the heart attack or after. This is a game changer in treating heart failure and heart injury and congenital malformations of the heart. So, your president, David Lebron, your provost, Jane, Paul, others, seek this collaboration. And they haven't just talked about it, they built this building to make it possible. But across the street, you've got similar partners who really want to work with you. Think about some of the topics that I mentioned and seek us out. Because together we will be better, and what we've already done together is spectacular. Thank God for Rice.